I hope we can all agree just how important SAMHSA grants are in our communities, and the ability it gives our nonprofits and our public health systems, the power it gives them to help our constituents. 5 months ago, you all might have been on the receiving end of some phone calls, just as my team and I were, when the Trump administration announced overnight massive cuts to the program. We got a flurry of calls and outreach from our community leaders who work on substance abuse and support for rehabilitative programs. And they were terrified about what these cuts would do to their ability to help our constituents. Thankfully, the cuts were reversed, and really that speaks to the power of the organizations that lobbied the White House, that called their members of Congress, that really took immediate action. But these cuts actually did have some pretty devastating effects on some of the smaller organizations. One of the smaller organizations in my community that offers support for people who struggle with opioid addiction and other addictions, they got the notice, and because their budget was so small and so tight, they were on the verge of their payroll. They literally announced to a number of their staff members that because these cuts would have such a significant impact on the budget, they announced layoffs. They eventually rehired many of those providers and many of the staff members, but the impact really demonstrated to us and to them that this kind of funding can't just be cut in the middle of a year without congressional consultation, without a process. So this amendment really is straightforward, and it just says that the administration can't do this again. And it will send a message. It will show the folks that we have at home working on these very challenging issues that we have their back. And it would tell the administration, you can't do this without coming to Congress and getting our support first.